Today is about where to find the empathy and how to make sure we're looking in the right spots and helping people show empathy to us, because we've got a big role. So as Jodie said, I work at Focused Health Psychology. I put up the names of my colleagues just in case you know them. I work with Siona and Liel. They're both wonderful psychologists, or provisional psychologists in terms of Liel. And we all have either a lived experience of a diagnosis of MS or living with disability in other forms. And we really enjoy bringing that personal experience to our work with people with MS and other neurological conditions. But I find it fascinating because sometimes I hear from somebody on the phone that has MS, oh yes, I'm calling you because I know you've got MS and I want to see someone who has MS because you'll know what I'm going through. And my response varies, because I like to think that I can bring a lot of empathy, but as you'll see with my definition of empathy, I don't know what it's like for somebody else with MS to live with their MS in their setting. I can't know that. I can hopefully be a good psychologist and build a rapport and get to know what they're going through their words and through their perspective. But just like these fantastic health professionals we have here, they have such a good, thorough understanding of what fatigue looks like in 350 different people with MS. And so do I. I've got lots of experience of learning from others what their fatigue feels like, how they describe it, but I will never know what it's like for them because they have a different type of MS or a different type of fatigue and how it presents, but it goes deeper than that. It's actually about each individual having a different set of coping strategies, each individual having a different family environment, each individual having a different take on the world, different personality. So much goes into why we experience things the way we do. And so it is really important for us as individuals to try and be empathetic to all and to never presume that we know what somebody else is going through, because we literally do not. So we have a focus on people with MS, and the three of us work from a positive psychology framework, and just loosely it encapsulates two different therapies, mostly. That's the majority of the work we do. CBT you would have heard of, maybe cognitive behavioural therapy. It's the gold standard of therapies for most people, but we love ACT therapy. It works really well for a lot of people with chronic health conditions because it has a big component of trying to work with someone around accepting what's out of your control. And if you live with MS, you know that there's quite a hefty dose of that when you're diagnosed. Oh my gosh, what do I have control over now? What is this uncertainty coming for me? How do I cope with this? And it's a life of figuring out how to live with that uncertainty. So a lot of the work that we do is examining people's psychological resources, what's available to the people that we're working with in their own unique way. And so here is a list from a particular author or group of authors, and they've come up with these psychological resources that we all have available to us, we use in varying ways. And it's also a great list of what contributes to somebody being really resilient. And I'm sure you'll be able to get these slides if you're interested in jotting them down. I don't want you to be trying to get them all down too quickly. And we're going to be touching on at least two of them, the ones in blue, the nurturing meaningful relationships and effective communication, today when we're talking about how to elicit empathy from people around us. But you can scan those ones and you can see that I hope you would all be able to relate to how you use those in your life, maybe some more than others. And they're a lot more meaty than you might think. And so as I was looking at this slide, I'm thinking something like goal setting. Goal setting is key to our ability to have a high quality of life. It's key to our ability to feel as though we're achieving things in the world and to bring us happiness. But most of you will look at that on a PowerPoint slide and just skip over it. Yeah, goal setting, blah, blah, blah. I do that, of course I do that. But it's not just about setting a goal. It's actually about all the layers of benefit that we can get by setting goals. And that includes setting realistic goals, very important to start with realistic goals. It's really important to be able to figure out a way to put working towards that goal into your calendar and to actually try to work towards that goal every day or every second day. Be active in your involvement of working towards a goal. But then, of course, when you reach a goal, the psychological benefit is about achieving something and recognising it and celebrating it and reminding yourself that you did that. And that's really important because it adds to a sense of self-efficacy, that sense of self-esteem of being able to say, when I know I'm faced with a challenge, I can back myself. So I hope that gives a bit of a thing of like goal settings, like, yeah, goal setting, whatever. But if we really kind of drill it down a little bit and see how we can make tiny little goals in somebody's life for them to achieve and celebrate, we can actually have an impact on their sense of self, self-identity, their ability to accomplish things, and that will lead to a higher quality of life. Tiny small steps, lots of little steps. And then I've put there at the end as one of the dot points, of course, psychologists should be talking, just as every other health professional should be talking to people about the habitual things, the things we should all be doing, the things that often will put people to sleep in presentations if we talk too much about diet, exercise, the need for sleep. Yeah, we've all heard it before, but they're important things to talk about too. So today, that wasn't even up to the overview. Today we're going to be talking about empathy and why it's important for people with MS. Who do we need to get empathy from? How do we nurture meaningful relationships in our lives so that we can create and design a great space for empathy to happen? And how are we going to increase our effective communication with health professionals so that we can elicit empathy from them, so that we can learn how to paint a picture for our health professionals about our situation, and the important bit here is it needs to include, for the greatest amount of empathy, it needs to include an element of how our experiences is impacting on our functionality. That's what health professionals, I believe, will defer to these guys. That's what they want to hear from us when we're giving our stories about how MS is hard and it's a challenge, or the increase in symptoms. They want to hear our stories, but they need to have context and they want to know how it impacts on our ability to function so they can help us with the fix-its maybe, or some solutions or some referrals or something that's meaningful. And I think it's really important today that we come to this part of the presentation with two hats. One of them is the hat of a person with MS maybe, or a carer or a staff member who wants to elicit empathy from others, but also we should be looking, just as both of our speakers have spoken about, in showing other people empathy is really important. The more empathy, the more practice we have in showing empathy to others, the more we'll be able to construct a world where others can show empathy to us, because we'll know how to get it from others. So many definitions. Sorry, I've got one too, but I really like the way this one was worded. It's we've talked about, stepping into someone's shoes, but I like this. It's the art of stepping imaginatively into somebody's shoes, or the shoes of another person, understanding their feelings and perspectives, and using that understanding to guide your actions. So it's very different to this one, which is, that person seems to be going through a rough time. Oh, well, if I was them, I would do this, this, and this. That's not empathy. That's you thinking about you being in that situation and what you would do. Empathy is about imaginatively saying, what if I was them, not me in their shoes? What if I was them and I had the lived experience they've got, and I had the social setting they have, the family members they've got, if I had the experiences, the pressures, the overwhelm that they have, I wonder how they're feeling. And if I really do that to my best ability, then how can I change not just the way I feel about them? When I can feel real empathy for someone, that's important, but how can I change my actions to show them support in real ways, not just words or, that seems rough, but how can I actually shape a better experience for them because I'm trying to understand what they're going through, not what I would do, which is very different, and we'll come to some examples. So it's not about you. Empathy is not about you. It's about you really wanting to know how they're going. And we aim to show it, not just feel it. So remember, we're talking about us trying to be more empathetic to others, and then how we as people with MS can get more empathy from other people as well. Is that making sense? I hope so. Okay. So why do people with MS need empathy? Well, we could have a great chat, couldn't we? We could get the food in and more cups of tea, and we could talk for hours. But I think that a big part of it is around the invisibility of this disease on so many levels. Dare I say, you may have never heard this. Gee, you look so good. You don't look sick. And we've got a whole slide of them, so we'll get to them. But the invisibility of disease symptoms means that empathy is really, really important. We need people not to just look at us and say, oh, well, I'm going to assess them on how they look and I'll show them support based on that. We need people to try and delve a little bit deeper and put themselves imaginatively into our shoes and try to figure out what it would be like. And an interesting example of this is just having a quick look at the difference between affective empathy and cognitive empathy. And I think Anneke spoke a little bit about this, that intellectual empathy. The difference between, that great campaign we had in maybe the 80s or the 90s for World Vision, and we saw so many people starving in Africa. And as a population of Australians in Melbourne, we would look at those television commercials and we would have this affective empathy. We would feel the pain and the helplessness of the people we would see on the television, the look of the mothers and looking at them trying to care for these children who were starving. And the empathy came from us in this real kind of emotional way. And it was a wonderful way to get us to help or try to understand. But it's very different to cognitive empathy, which is really about trying to understand what has produced this in this person's life, in the system, in society. How have we let this happen and how can we change it from a bigger, broader perspective? Now, we're not looking to change other people's situations when we are showing them empathy, but we are trying to look at it both from sitting with someone who's upset and feeling empathetic with them, feeling the emotions that they're feeling, maybe, or just being aware of that, but also trying to see it from their point of view, from their perspective. We also need people with MS to be shown empathy because their quality of life can be reduced in such invisible ways, but such dramatic ways, including the impact that this condition can have on people's goals, on their expectations of themselves, but also of others, and the lived experiences. And that takes a blow. Self-identity takes a beating when you have MS, for some people, not for everyone, and it can be really difficult to reconcile. How do I incorporate this label into my life? How do I continue on? Am I still going to be the same person? How is this going to change things for me? It's all so invisible but so massive. And so we really need people to be able to show us empathy because we're going through this time, but we look exactly the same, potentially. Understanding can be really hard because of other people's lack of lived experience of the symptoms that you might be going through. And it is really tricky. I've had a conversation with a good friend of mine, actually, who, we didn't talk about her trying to examine how to be more empathetic to people with MS, but she was really trying. And she was saying, I've been thinking about MS fatigue, which is interesting because I don't know why in particular, but she was like, I was trying to just get my head, like, why is it so different? Everybody talks about it being so different. Is it anything like the first trimester of pregnancy? And I was like, that's really interesting. And she said, that's the only thing that I can think of that was fatigue for me that was more than just being tired. And I love that as an example because she was scanning her brain. Where is my lived experience? What can I draw on that might be similar? And she was able to say, I'm not saying it's the same thing, but is it similar? She really wanted to know, is it a little bit like that? And I thought that was just a great demonstration of her really trying to get all of her empathy together so that she could do as good a job as she could in understanding somebody's experience. So this is this slide. Has anybody had these words uttered around them? This is an example of lack of empathy that can just be thrown out. Other people just throw it out and they think it's a compliment. You look so good, you don't look sick. When people aren't better, when people haven't been cured, I thought you were on medication for MS, so why are you still complaining about it? I thought they'd fixed it. I find these ones really challenging. Oh, shouldn't walk away from the camera, sorry, to those at home. But the people that I work with that have worked hard in an employed, let's just as an example, they've been employed for many years. It was a big part of their sense of self. They loved their job. And then for years, they worked less hours. They managed their MS and their work-life balance as well as they could. And now they find themselves in a position where they might be on a disability support pension, they might be at home, and it's been really tough. And a well-intentioned brother-in-law said, man, I'd kill to just stay at home on the couch all day. I hear that all the time. And the person with MS goes, yeah. And inside they are crying, they are dying a million deaths, because how do you say to the person that says it in a nice way, they think they're saying it in a nice way, how do you say to someone, this has been the worst experience of my life, all I want to do is work, I wish I could continue, I was passionate about my job. How do you bottle that in a friendly fashion to explain to someone that actually this is really tough and you don't get it? It's hard, it's very hard. So in words, we can hear lack of empathy all over the place, and we have to be cognizant of the fact that people mostly don't intend it to be a jab or a throwaway comment. They're not meaning to be mean, but it's what's socially appropriate. Often it looks so good, can be fantastic for people with MS to hear that sometimes, and it can also be really horrifying, depending on the day. But we can also see a lack of empathy happen in actions as well as words. So as a group of people with MS, if I say that sometimes in the lead up to Christmas, I have many conversations with people about MS about how are they going to get through another family Christmas barbecue in a park on a 35-degree day, and my family don't get it. They don't hear me when I say I can't do it, or they say it's only going to be 28 and there's a bit of shade over there if you want it. You'll be fine, won't you? And so it's people with MS that say, I try to communicate it and they just don't get it. I'm not going to go, and then I feel like I'm being treated like I'm the difficult one in the family, but how many times can I tell them I can't have an outside barbecue in the sun on Christmas Day? So we want to feel that empathy through planning and action and consideration. And sometimes people with MS don't feel it. Who do we need empathy from? I really just put down any kind of category of people I could think of because it's everyone. Randoms is probably not a technical term, but I thought I'd throw it in there. They're the people that say, you've got a disability sticker, so I'm not sure that you need one. That's what I mean by randoms. Or the people that give you a really bad look or just look at you the whole time on the bus because you're sitting in that emergency seat or the seat that is there for people like us that might need to sit down on a bus. So they're the randoms that, I don't know how that's a bigger issue, I think, to try and elicit empathy from them, more of a public campaign issue. But there are many people that we want empathy from, and that empathy can look different on different days. And we're not going to elicit it in the same way from all of them. So I'm a big believer in let's do what we can to help people show us empathy, particularly partners, particularly health professionals, friends. But do we need to sit down and have such a robust kind of conversion with our neighbours or people at school drop-off? Maybe not, but we need to, I guess, pick our audience and think of our messaging. Always think of our messaging. What is the message that we want to send to this person, and is it appropriate for what we want? So now we're looking at nurturing meaningful relationships. So how do we get this empathy? I think it really comes down to being able to be comfortable to share our experiences with those people, no matter which audience member we're talking about, but it will be different messaging for different people. To share our feelings and perspectives really genuinely and authentically. If we can do that, it's hard. And we're going to talk specifically about health professionals. Sometimes it's even hard with them. Sometimes it's even more hard, more difficult to be genuine with our health professionals for a few reasons. I always encourage people to be strategic about their communication, to really sit down and think about it before you have any kind of meeting, even if it's with the neighbour. If you're wanting to talk about something to do with your MS, have a think about what are the key messages I want to send, and can I make sure one of them is, if you've got any questions, ask me, but I don't want to give you the whole life story unless you're really interested. You can put some caveats in so that people can feel happy to come back and ask you more questions, but you don't feel like you have to give them all of the story in that one instance. It's important for us as people with MS to acknowledge that the MS that we have in our body actually impacts on others as well. That's important. They don't live with having to deal with the symptoms that are in your body, but they do live with MS in the relationship, no matter what relationship that is. And so it is up to us, the person with MS, to make sure that they have as much information as they need to best support us and for us to help them with this. It's not fun. No partner of somebody with MS wants the person they love the most in the world to be living with this. They don't want this for you either. So it's important for us to give them as much information as they need to support you as best as they can. And sometimes that's hard for people. They don't want to talk about it. They certainly don't want to whinge about it. They'd rather talk about something else. And, you know, that can lead to some bad outcomes for relationships. So we need to focus on empowering ourselves to talk about it for our benefit, because it's important to talk about what we're going through, but also for the benefit of other people as well. We have to allow them in, and that will hopefully assist them to provide us with empathy in thought and feeling, but also in their actions and taking it into consideration. So to health professionals, this is what not to do, and I hear this all the time. Don't go and see your neurologist or MS nurse like it's a job interview. Oh, how are you today, Sally? I'm really well, thank you. Yeah, I'm great. I'm fine. It's not the time to be the most positive you can be, because as these guys have told us, sometimes they always have limited time for all of the clients in the waiting room, all of the patients there, and they want to be present with you. They want to hear you. They want to be able to get valuable feedback from you and data about what's happening in your life. They don't need you to gloss it. They don't need you to make it look shiny. They actually want the real grit and the detail. So it's very important to recognise that as much as your neurologist, your MS nurse is a lovely person and you feel like you've got almost a friendship going on, they do not expect an equal balance of they're going to ask you a question, then you should ask them a question back. And make sure you say, well, how are your kids going? They don't need to tell you. I'm sure they appreciate it. Am I right? I'm sure that they appreciate the genuine question of how are you, but they don't expect this to be 50-50. And I think a lot of people with MS really want it to be 50-50. They'd prefer to have a friendly discussion rather than play the patient role, particularly if they have that really good rapport with their health professionals. A lot of people with MS, they don't want to bore their health professionals, so they almost take it the other way. So some people are saying, look, we're almost friends and I don't want to, weigh them down with that. But then there's the other thing of they hear it all day. Like they're just talking to people with MS all day about fatigue. I don't want to be telling them about my fatigue. They've heard it all before. I just won't talk about it. And a lot of people with MS do this. They kind of take this idea that the neurologist will be bored with their account. There's no way they can describe it in a different way to anybody else, so I'll just leave it. What are they going to do anyway? Is this kind of, they're not going to be able to fix it, so I'll just not talk about it. It's not okay. Not in terms of eliciting empathy, and for lots of other reasons, but where if we paint a small little picture or if we don't give them enough depth, they're not going to be able to help us in the same way that they could if we gave them more. And what can happen is that we end up forming relationships with our health professionals that does not give a really genuine appreciation of what we're going through. And often people will say, look, I've had moments of maybe some continence issues, maybe some bladder, but it's not that big a deal, so I don't know, I probably won't bring it up. It happens all the time. Okay, maybe I'll bring it up next time. I don't know. And there's a lot going on for the person with MS there as well, because actually vocalising it to your health professional is quite confronting, because you can say, I'm a middle-aged woman, I've birthed 2 children, we've all got a bit of continence going on, so it's probably normal. My friends tell me, we're all getting older, so I won't bring it up. But these are the people to bring it up with, and they want to hear it. And it can lead to things, a lot of people with MS will, look, I've got somebody at the moment who I'm speaking to who has MS. They're also under the care of a psychiatrist and they see me as their psychologist, and they're not taking their psychiatric medication. Have you told the psychiatrist? Nah, I don't know. They really want me to take it. They think it'll work, but I know it won't work, so I don't take it. Right. It's really important that the psychiatrist knows that that's going on, But this person likes their psychiatrist. They don't want to disappoint them. So they're not going to tell them that that's not what they're doing. It's really important for us to give our health professionals an honest account of what we're going through. People also shy away from telling their health professionals that their symptoms are getting worse because they don't want to disappoint them. The neurologist, the MS nurse might have been so excited about a particular new drug that you've been put on as a person with MS that this is going to work, or we really hope it will, it's great success rate. And people with MS don't want to disappoint the health professionals if they feel it's not working. So they just go along with it. Yeah, it's great. And it's not going to help us get that empathy, because after a year or two, I will have people with MS say they just don't get it. They don't understand. And so we have to dig a little bit deeper to see, well, have you given them the picture that they need to understand? And sometimes the health professionals don't have any of the knowledge they need to understand. I think that people that work with people with MS, neurologists and MS nurses, are amazing at being able to read people. They spend a lot of time trying to read the person in front of them. Are they giving me the full picture? Do they actually want to talk about this? Or am I getting the cues that says they don't want to talk about it? And they have to very quickly make assessments on the person in front of them and what do they want to talk about. And there are lots of people with MS that do not want to talk about progression. Don't talk about it with me. I don't want to know. It will make me feel bad. Please don't bring it up. And they're equally, maybe, a group of people with MS who are saying, my neurologist won't talk about progression. Like, I am clearly getting worse and they won't name it at all. If I bring it up, they don't say anything about it. And so the people that sit in front of us are trying to assess desperately quickly in a very short session, does this person want me to talk about that, or do they not want me to talk? How can I best meet my patient's needs? And I'm going to have a guess and hope I get it right. And then as a psychologist, I have people with MS say, I can't believe she brought it up. Or I can't believe that neurologist said that to me. And I think that neurologist would have been sitting there thinking, am I saying it the right way? Am I picking my audience? And the only way they're going to get it right 100% of the time is if we as people with MS say, this is what I expect from you. This is the type of communication I want. These are the topics I want to talk about. And then they go, great, thank you. Let's talk about it. Not, should I, shouldn't I? It's hard. They have our word to go on, and their amazing skills in trying to get the non-verbal cues from us. Is she comfortable? Is she not? Is she trying to run out the door? Or is he sitting here, he wants to talk about something else? What should we be doing? We should be painting the picture. They really do want the detail. And this is how we can get the empathy. This is how we can get the kind of complex support back from our health professionals. Not just the script and good luck, but a really thought out, they see you as a whole person kind of support. If we give a good picture with enough detail. I would love people to describe their experiences to their MS health professionals with two things in mind. One of them is to give that rich story. I don't mean a half-hour story. I mean a rich, short story. I mean a well thought out, what am I going to speak to my neurologist about today? I want to talk about fatigue. What do I want to tell them? Well, I want to tell them that I think it's got worse over the last 3 months. And I've got to check my own baggage, which is, well, everybody with MS has fatigue. I shouldn't complain about it. They hear about it all the time. Actually, I know it's changed. I need to convey to them that it's changed. Now, I've put evidence is good, and I mean that. Psychologists love telling people to write things down. So keep a diary. I'm going to see my neurologist or my MS nurse in 2 months. I'm going to keep a diary for 2 months leading up to my appointment. What do I notice? What am I noticing? Now, you do not need to take every dot point, every diary, every piece of paper into that appointment. They don't need that. And that will just hold things up. But what they'd love is a bit of a summary. So for you to say, I took all this evidence and then I realised, when I looked back over it before our appointment, I realised that actually the fatigue is getting worse. And I could see it spike around Christmas, fair enough. But then I also saw it spike at the end of January and there wasn't really a reason for it, on that practical level. So I think it's more about my MS. So I wanted to bring it up today. And that's good information. But I think what they would like on the secondary level is a bit of detail around your functionality. because they hear, I'm so fatigued by so many people. And by one person, it means I'm so fatigued, I didn't get to go to the second nightclub on Saturday night. I was only up until 2 a.m. So that was a real problem. And for the other person, it was, I'm so fatigued that I've actually reduced my work hours significantly and I missed my child's presentation night at school because I could not get there. I was in bed by 4 p.m. And those two accounts are very different. And for us to say, I'm so much more fatigued than I was last time I saw you, with no detail around the impact on the functionality, they're kind of flying blind. Because we all know what it's like. Somebody describes something, it was the worst day in their life. And if we're not using our empathetic hat, if we're just saying, how would I feel in that situation? Sometimes we go, oh, that'd be fine. I wouldn't mind if that happened to me. But for others, it's really about and it's always with empathy, it's about from your perspective. You need to tell them from your perspective. What is it changing in your life? What has it impacted on? So that they can try to imaginatively get into your shoes and say, oh, right, you're telling me it's impacting dramatically on your functioning. That's important for me to hear. Continence is a great one. Oh, I'm having a few continence, but I don't think it's anything, like it's no big deal. But if you give them an example, so I had, you could say I had 2 trips to the supermarket and both times I had accidents. And now actually I don't do the supermarket shopping anymore. I do calls online and I'm really worried about leaving the house. If you're spelling it out like that, they're getting an instant picture of how this is impacting your ability to function. Resist downplaying any of your symptoms. They'll know, they have a good sense, particularly when you give them firm examples of what they can do. And this eliciting empathy will lead to more support. And then, of course, the big one at the end is to be really cognizant of the fact that they are human beings, and how refreshing is it, sorry Anneke to talk about you while you're there, how refreshing is it to hear a neurologist say, sometimes I have a bad day. I just think that's so wonderful. I don't think we hear it enough from medical specialists. We really do, I think, as a society, hold them up as these people that, they're very important. They have very important jobs. They have this extreme knowledge and they should be available to me 100% every day of the year, not available like for the phone call. But if they're sitting in an office with you, we kind of expect them to be 100% on all the time. And it's not very compassionate. We have, a high level of expectation from our health professionals, and we should, but we also need to kind of flip the empathy a little and understand that they might need something more from you that day, and that might be a better picture for us to show. That might be an ability for us to remind them. They have 1 million patients on their books. So when you say, oh, remember the problem I told you about last time? Well, it's got a whole lot worse. That's really harsh. But you could say, so last time you might remember that I discussed pain, the pain issue I was having just in my left leg, and they'll say, oh, that's right. It'll help to give them a little reminder. And that's showing empathy, because what we're doing is we're saying, we know that you have a lot of people with MS who are telling you lots of different stories. It's okay for us to remind you who we are, because we're all individuals, and yet they hear 15 different stories about fatigue every day. So it's okay for us to remind them which story is yours. And they are trying to get into our shoes from our perspective, so we need to be able to help them to do that. Essentially, it comes down to the idea of teamwork, and that's the case with every interaction we have with the healthcare system, whether it be private or public, whether it be working with MSL or your GP. It really should be a team approach, and I think we're seeing, the burden is on the person with MS at the moment, but hey, I would prefer it to be there than it was 20 years ago, where we would never get a copy of the letter that was sent to the GP. Never, I think. 20 years ago, not a chance. That wasn't for the patient to look at. And so we're moving slowly. Should it be better? Of course it should, but we're aspiring to it. The young people will do it, as Jodie said. They'll get an app for it and we'll all be fine. But until that point, we have to take a bit of ownership and say, okay, we can move a little forward. The health professionals are moving a little bit closer to us in what we want, and we'll work together as a team. I think that was my last point that I wanted to make. So thank you, everybody, for listening to me.